I said, those were going to be really brief discussions on comparing the differences and then COVID-19. But now we're actually going to get into how to apply for a CLIA certificate and how labs can start helping with COVID-19 testing. So to apply for a CLIA certificate, it's actually a two-part process. The first part is to have a lab apply through the CMS 116 form and obtain the certificate of registration. This actually goes through CMS, this portion. Then there's going to be two different routes that a laboratory can take. The laboratory can take a accreditation route and receive a certificate of accreditation, and that's what we're going to be focusing on today. But that is not the only route that a laboratory has to take. A laboratory could also do the certificate of compliance route and complete the compliance process to get a CLIA certificate as well. So you don't have to be accredited for COVID-19 testing to do COVID-19 testing if you do the compliance route. We're not going to talk too much about this compliance route, but I will give you the definitions on the next slide, so then you have an idea that there is two options for you to choose from. So there's some definitions that we're going to need to know moving forward. There's a certificate of registration, and this certificate of registration is given to labs after the CMS form has been approved by CMS, and it's an in-between between doing the CMS 116 form and then actually receiving that either certificate of compliance or certificate of accreditation. And this registration certificate is only valid until inspection is conducted and compliance is determined. And when I say inspection, inspection is similar to an assessment. They're interchangeable words. Just in terms of CMS, they will use the word inspection, as you can see from their definitions. Then there's a certificate of compliance. And with this certificate of compliance, it's when a state agency or a CMS surveyor actually goes out and conducts the survey or assessment and determines if the laboratory is compliant with the applicable CLIA requirements. So the difference between a certificate of compliance and a certificate of accreditation is a certificate of accreditation, an accreditation organization is going out and performing that assessment and granting laboratory accreditation, when CMS for a certificate of compliance is, or the state agency, is going out and performing that assessment. So there's still going to be assessment that occurs with either process. It just depends on who's going to do that. And then a certificate of accreditation. So this is issued to the laboratory based on laboratory's accreditation by an accreditation organization approved by CMS. You'll notice the wording accreditation organization rather than accreditation body. In CMS's eyes, accreditation organization is the terminology that they use. So you won't see any terms saying accreditation body. You'll see accreditation organization. And one thing to really note here is that approved by CMS is written in the definition. So A2LA is actually one of the organizations that is approved by CMS, and we are the only organization that holds CMS deemed status as well as ACLAC recognition. There are a couple other organizations, though, that hold CMS deemed status. Those are AOA, the Joint Commission, AABB, COLA, CAP, and ASHI. So there are some other organizations as well that are in this accreditation organization networking. Also, all of this information in terms of the accreditation organizational list is found on the CMS website. So for the purpose of this presentation, I'm actually going to walk you through kind of the application process. If a laboratory is to apply for a certificate of accreditation and they're using A2LA as their accreditation organization. So there's going to be a two-step process, kind of like what I talked about before. The first part is through CMS. So with this, you would actually fill out the CMS 116 form and provide it to your local CMS office. With this CMS 116 form, you would supply your laboratory director qualifications as part of that application package. The CMS local office will, Sorry to get a frog in my throat. So the local office will actually review and process that CMS form, and they'll also qualify your laboratory director. Once your laboratory director has been qualified and your CMS 116 form has been processed, you'll receive a CLIA ID number, and that's when you can actually start doing that COVID-19 testing. So that's kind of where you're getting your aha, okay, we're finally getting there moment. You do have to pay a fee though, so just to make a note, you do have to pay a fee, and it's a fee remittance coupon that you'll receive. Once you pay that fee, you'll actually receive that certificate of registration. And that certificate of registration is going to be kind of a kickoff point for a timeline that we'll discuss in a moment. In addition to applying to CMS, a laboratory would also need to apply to ACIL for accreditation. So this can happen simultaneously with applying to CMS, but CMS will not apply to ACIL for your lab. That is something that you will have to do. So it's two separate processes. You would go through the ACIL accreditation process, which we'll talk about, as it is different. If you're used to 17025 accreditation process, there's a little bit of differences. And remember that timeline that I said. So going back to that timeline, you have actually 11 months from receiving that certificate of registration to receive accreditation and provide that accreditation certificate to HHS, the Department of Health and Human Services. So that's where I said that timeline. We want to keep that timeline in the back of our heads moving forward. So now we're going to start actually getting through the actual process. What does a CMS 116 form really want us? And start kind of breaking down the process even further. So this CMS 116 form will be filled out by you and it'll be submitted to your local state agency. Don't worry about trying to search multiple places for the state agency as information, as it can all be found on the CMS website. You will notice that the laboratory will need to estimate their annual test volume on the CMS 116 form, and that is something, just so then you don't get surprised when I ask that question, I like to put that out there. You do have to estimate that. It's a question on that. And then before you submit your CMS 116 form, your laboratory director qualifications must be added to the application to have a completed CMS 116 application to hand to your state agency. So you might be asking, okay, so what are the qualifications that we're looking for? What might be needed for a laboratory director? So the specific laboratory director qualifications can be found in subpart M of the 42 CFR Part 493. Since this is federal regulation, you actually can find this on the website. You can find this document. And there is going to be specific laboratory director qualifications for moderate complexity laboratories as well as high complexity laboratories. With these qualifications, some of the items that you would include for your laboratory director would be a verification of the state licensure, some education information such as transcripts, diplomas, items like that, credential and laboratory experience information. Credential and laboratory experience information will probably be found in a resume or a CV, so that's where you would find that information. All right, so the big question, when can I actually start testing? When can my lab start helping with the global pandemic? So after you receive your CLIA ID number, you can begin that testing. And that is something different for COVID-19 testing. Traditionally, you would wait until you would receive that certificate of registration before you would start testing. But because of the global pandemic that is going on, CMS has provided guidance that once you receive that CLIA ID number, then you can start that COVID-19 testing. So that is something really important to note. And then just a friendly reminder, you still have to pay that fee remittance coupon to receive that certificate of registration. So that kind of closes up the CMS process at the beginning. And now we're going to move on to the accreditation process. So either at the same time or right after you submit your CMS 116 form, that's when you're going to want to start that accreditation process. You're going to want to go to ACIL's website and apply for accreditation. Then you would receive a Touchstone account, and this is where all your information is going to be asked. So with your laboratory, you would need to complete an application and upload some checklists, as well as submit some procedure manuals, SOPs, work instructions, quality manuals, a copy of your CMS 116 form, etc. With the checklist, there are going to be 2 specific checklists that you would look into and submit as part of your application documents. That's going to be the C601 checklist. That's actually just going to be the general requirements for CLIA. That's not going to have any of the specific subcategory, subspecialty, or specialties within it. Then there's going to be an additional checklist that has your specialty and your subspecialty. So there are going to be some additional checklists. It's not all in one checklist just because that would be extremely long, and it breaks it up because not every lab is applying for every specialty or subspecialty. You'll also notice that I mentioned a copy of your CMS 116 form, and that's going to be a really important document to submit to A2LA. We'll want to see your completed CMS 116 form that you received back from CMS because it'll have your CLIA ID number on it, and that's going to be important for A2LA. We use it not only on your scope of accreditation because it will be listed there, but we also have to use it for CMS. Your laboratory will also provide a list of all your testing that's performed, an equipment list, and a service provider list. With the testing that's performed, if you're used to a 17025 scope of accreditation or a testing scope of accreditation, this is going to look a little bit differently to you when you look at these scopes. Because typically there's only 2 columns found, a test and a test method column. With clinical scopes of accreditations, and when we ask for your list of testing, we'll ask for your specialty, subspecialty, test method, and matrix. So there's a bit more information that's going to be found on these scopes and that we're going to ask for with these tests when you provide that list of testing. Accreditation officers will review this for completeness, and the assessment team, once it's completed, the assessment team will be proposed to your lab and will go through the assessor assignment process. You might ask, okay, so who are your clinical assessors at A2LA? And that's a really good question. You want to know who's going into your lab and going to be assessing you, and are they qualified? So our clinical assessors here at A2LA are pathologists, medical doctors, PhDs, and medical technologists. They've completed our A2LA training course, which is a 5-day classroom course. They've also passed the written exam, been evaluated from direct observations as they're conducting assessments, and they have a minimum of 10 years of direct experience with their chosen areas of expertise. So some have over 20 years, but at a minimum, we require 10 years. In addition, these assessors also have extensive experience assessing CLIA labs. And we use third-party independent subcontractors for our assessments and not peer surveyors. So some organizations, accreditation organizations, will actually use peer surveyors for these assessments. That being said, with an applicant laboratory who do go to these other accreditation organizations, they would be required to volunteer a surveyor for a future assessment. A2LA doesn't require that. We use third-party subcontractors, so you don't have to worry about volunteering, say, your lab director to come and do someone else's CLIA assessment. They're also involved in writing standards. So one of them is the Clinical and Laboratory Standard Institute. And they also are provided with refresher training at A2LA's annual tech forum that happens every year. So now we've got your assessor fully assigned. You receive the formal assignment notice, and they receive the formal assignment notice as well. They'll be provided with the application material that you provided in your application to become familiar with your lab. So they'll provide that before they go on site. But there is a couple differences that we can see here, and they're bolded. So if you're used to a 17025 assessment, you're used to getting a document review, and that's kind of nice to have. Well, with clinical assessments, you actually will not receive a document review prior to the assessment occurring. If there is any nonconformances found within the assessment, they'll actually be put directly onto your deficiency report, and you will not receive that until they are on site. So you will not be able to provide any corrections for any nonconformances. Also, the assessments are unannounced. So when we're working through the assessor assignment process, will actually ask the laboratory for blackout dates. These dates are the laboratory cannot have an assessor on site, and we will let your laboratory know about these, or your assessor know about your laboratory's blackout dates. They will provide an agenda within 2 weeks of the assessment occurring, but remember the assessment is unannounced, so they won't be contacting you and sending a welcome email of saying, hey, what date works best for you? So that is something different to note. So we've gotten through the stress and the worry. The assessor is on site now performing the assessment. So what are they going to look at? So they're going to look at the CLIA requirements when they're on site. These will be the general requirements as well as the specialty and subspecialty requirements. They'll also look at ACIL's requirements for accreditation as well. So it's not just going to be just CLIA requirements. There are some additional requirements that you will see them assess to. So the assessor will spend time in the laboratory reviewing interviewing technicians, observing them, talking to laboratory personnel, and performing an assessment. You'll also receive a deficiency report detailing those nonconformances at the exit briefing. Remember, if there are any nonconformances that are found in your document review, you will see them on that deficiency report. So say you have deficiencies, now what is the next step? So you would provide corrective actions to ACIL within 30 days of the assessment ending. And the corrective action responses that you would include a corrective action with objective evidence, as well as a root cause analysis. I apologize for keep drinking. My allergies are very much bothering me today. And these will be reviewed for ACIL or reviewed by ACIL staff members. So say additional information might be needed to close out a deficiency, we would request that, and this would all actually be through Touchstone. So remember, I kind of briefly mentioned Touchstone earlier. Touchstone is going to be the portal that we're using for everything. So corrective action responses, if there's any additional inquiries, anything like that will all go through Touchstone, and it'll be a repository of information. So now we've closed out all of our deficiencies, and we are feeling really good. We've closed it all out. Now we're going to send the assessment package to the Accreditation Council for voting. So this Accreditation Council will provide the vote on if accreditation is granted. Accreditation is granted only when all issues are resolved. So that is something to note. So now you've received your accreditation, and that's super exciting. You've done all of this work, and you've done a really good job doing it. There's a couple more things that you need to do, though. Sadly, it doesn't end right there. So there's only actually one. So you would need to provide your certificate of accreditation to HHS once your certificate of accreditation is granted. That's not something that ACIL does, that's something that the laboratory does. But remember, just something to keep in our mind, we do have that 11-month time frame that we really need to work in, since it's mandated that we have to have accreditation within 11 months of receiving the certificate of registration. So that is just a timeline that we're going to want to constantly keep in the back of our head as we're going through this process. So just to kind of recap on some of the key differences that I hinted at throughout the presentation, if you are used to a 17025 assessment versus CLIA. The assessment will be unannounced. That's just a big one to note in general, just because that's something different. You'll be provided with an agenda, but it will be an unannounced visit. All CLIA assessments have to be completed in person, and your document review won't be shared with you prior to the assessor coming on site. So that's all something to note. So I've talked a lot about CMS, and I've hinted at a lot of resources that are on their website. Their website is full of information and is a good starting point for any lab that is interested in going to CLIA, because they actually have to download that CMS 116 form. That's kind of your starting off jumping point for CLIA from that website. On that website, they'll also provide you with information on your local state offices for CMS. as some states have some additional requirements. When you submit your CMS 116 form, they would talk to you about that. The local state office would. It also has some information, some brochures that are really helpful. They actually have a brochure on how to apply and obtain a CLIA certificate. So for any labs that are doing research, for example, what might that take, and what might, they have some kind of weird questions that, maybe you didn't think about at this moment, but you thought about, they might have it there. So this website is a really good place to start, and it's kind of your starting point just because you have to download that CMS 116 form from that website. So before I take questions, I just wanted to say thank you so much from us at A2LA to allow us to have this presentation and talk to you guys all about CLIA. It is a very interesting world, and definitely with a global pandemic, everyone can help in some way. So I'm super happy to answer any questions that you might have and kind of talk to you guys more about this.
Carlyn, thank you so much. We really appreciate the time and the very clear explanation that you've laid out for us with the presentation. If you wouldn't mind sharing that with us, then we will ensure that it gets out to everyone that was here today. Yep. With that, we will open it up for questions. If you want to ask Carlyn a question, please do so. And otherwise, please keep it on mute so we keep the background noise to a minimum.
Yeah, hi, this is Scott Griggs here. I'll ask the first question. I promise these are not seated questions or anything like that. But so Carlyn, thanks again so much for making what is a very detailed and process sound so simple to go forward. So thank you for taking the time. So my question, Carlyn, has to do with many of us have multiple locations across the United States. And let's say we have a lab in Massachusetts and one in California on extreme ends of the country. So you said that the lab director has to have state licenses. So if that were one individual, they would have to have state licenses in both states. Is that correct? If I understood that right?
So that's a really good question. In regards to that in particular, so every single lab has to apply for a separate, let me restart that. Every lab has to apply for a separate CLIA certificate, as they're in different locations. And CLIA is kind of like A2LA with accreditation, that it's location specific. In terms of the laboratory director qualification, the best place is actually when you're talking, because states sometimes will have additional requirements. Maybe one state doesn't have a particular licensure that it needs, and it can use a different state licensure. So the best kind of place and where you're going to start making those kind of small conversations is actually with that local CMS office that you're going to supply that information to, since that's more of a CMS call. I know that's not a very great answer in terms of that, but they are the best people because there are some specific state requirements that might fall into place depending on each state, because each state's a little bit different. You really want to ask that particular state their question, just because A2LA doesn't deal with so much of the state side. We do in terms of like we go and do assessments, stuff like that, but those specific state requirements, that state local CMS office is the best people to clarify that with.
Excellent, and thank you. And then just one more question. Yeah. This sounds very much like a U.S. and its U.S. territories only program. So if a lab, let's say in Canada, wanted to gain this accreditation, could they?
They could. So there is actually a special place on the CMS website and a special email address for international labs that are looking to seek CLIA accreditation or a CLIA certificate. So there is some differences that will be found there. There's a special email address as well for those international, because there are some international organizations that do want to be CLIA. So there is some additional kind of wiggle room is not what I was trying to say. That's just how it came out. There is some additional kind of requirements and maybe some steps. And they actually have a link directly on the CMS website where you can go and click, and it brings up an email address, and it actually has you email specific questions, and or if any international lab is interested in CLIA, that specific website or that specific email address, because they're able to answer those specific international questions.
Excellent. Thank you.
Thanks for the questions.
Carlyn, we have a few questions that people texted in on the chat on the side, so I'll go through those.
Oh, perfect.
So you know this. The first was, how early can we get the ID when we start testing?
So that is a great question that doesn't have a very great answer, sadly. So I know CMS is working really hard. We have not received a definitive timeline from CMS of when you submit that CMS 116 form to how long it takes to be qualified or to have laboratory director qualified. So there isn't a defined timeline. I know they are working kind of around the clock, especially with the COVID-19 situation and the global pandemic that is going on. They're constantly working. So there's not a good timeline to gauge, okay, it's going to take, 7 days to do this, a 7-day turnaround time. It might take a little bit longer, a little bit shorter. There isn't just a great timeline. And especially because it's going to each individual's local CMS office, it'll kind of depend on that local CMS office.
Okay, looks like the next question is, what is the advantage of accreditation over the certificate of compliance?
That's a really good question, and there's some differences between them. Personally, there's probably not one advantage over another. With the certificate of accreditation, you're doing it through an accreditation organization, so that's kind of one of the advantages rather than doing the state. Sometimes time frame can be an advantage depending on the accreditation organization. On the flip side, though, there is also the idea, and just to play both sides of the coin here, with the certificate of compliance, sometimes accreditation organizations put additional requirements on, accreditation requirements, that the certificate of compliance does not. So just to kind of play both sides of the coin, certificate of accreditation, then you have your certificate of accreditation, you're with an organization, for ACIL, you could possibly have, a fee difference in terms of scopes, something like that if you've already have a scope with ACIL. So that's kind of the difference between them.
Okay,
it just really depends on what type of position you would like to go with.
Okay, it looks like the third question I think you covered when with the first one about the CLIA ID. Are there any other questions that anyone else has that they'd like to throw at Carlyn? You did such a good job that no one has any more questions.
I just have a question. It's Mary Kate Crowell. Just asking, if you apply for the ID and you get the ID, and as we move along and say somebody comes up with some kind of vaccination or whatever, and the whole pandemic ceases to exist, what if you never apply for the compliance certificate or the accreditation certificate? What would happen if you had done testing but then didn't follow through in the end because it kind of died off and you didn't have any testing going on?
So that's a really good question. And actually on the CMS 116 form, you would actually check certificate of compliance or certificate of accreditation. So that is something that you would have to check on that CMS 116 form. In terms of, say, everything works out in the world and, everything dies off, say, in 2 months. Maybe that's unrealistic to think, but maybe for some reason a miracle happens and everything does happen. They have not provided a lot of clear guidance. I can definitely look up some more information about that particularly. I have not had any experience with that personally, but I can definitely provide some more clear guidance and kind of take that note and provide that. If Shannon and Scott, you don't mind, I could provide that with the presentation if I can find out some more clear information, just because they haven't provided super clear information of that, because I know they're really focused on the global pandemic at hand, not if people apply for this and what happens when it all goes to way.
Any further questions? Well, thank you all. I want to make sure I didn't. There's one more person that may have a question. One moment. Are there any specific educational requirements for the lab director?
That is a great question. And there are actually specific education requirements for the lab director, and they're based on the complexities. So your lab would either apply for a certificate of accreditation or a certificate of compliance. These are for both moderate to high complexity laboratories. So within the CFR, there's actually going to be sections for moderate complexity and high complexity laboratories, and the laboratory director qualifications for each of those. So there are some specific educational requirements. Some is like medical doctor, some is, so they do have some specific requirements in terms of those.
Any further questions? What subspecialty category would the COVID testing fall under, Carlyn?
That's an awesome question, and I've already thought that someone was going to ask me, and I was just waiting for it.
Knew it was coming, huh?
Knew it was coming, you know, just waiting for it. For the PCR testing, since it's more of a virology testing, so they have not officially come out and put specialty and subspecialty. It will probably fall under the microbiological subspecialty, since virology falls under, or microbiological specialty, since virology falls under that. It would be the microbiological checklist, if anyone's curious, for the additional specialty and subspecialty checklist.
Any further questions from the participants now? Looks like we have one here. For international laboratories, are there additional requirements?
So that is a great question, and I don't know if anyone's off the top of my head. Again, you would have to email. I can provide that link as well. There's a specific CMS web on the CMS website. There's a specific page for international labs that they have an email address that you actually provide all of their information and kind of questions to. I don't know of any particular ones, but that doesn't mean that there aren't any. The CMS office who deals with the international locations are probably the best ones to talk to about that, and I can provide that link. In terms of A2LA, we haven't made a special international checklist, so.
Understood.
Wonderful. So I think, again, thanks so much, Shannon. Thanks so much, Carlyn, for everybody setting this up. It's been very helpful. And we really appreciate you taking the time and providing this information for our members of ACIL to think about in how they can pivot their laboratories to better serve the country.
Thank you again for letting me come on and present this information and kind of giving you guys some more background information. If you have any questions, please let me know additionally, and I can try to answer as best I can.
Well, thank you again. We're most grateful to you, Carlyn, A2LA, and everyone that joined in and participated in the call today. We appreciate your questions and clarifying a little bit more issues that are at play here. For those of you who are ACIL members, in these sections we'll be following up with the materials that Carlyn referenced, including the PowerPoint presentation from this webinar. And if you have any other questions for us, please don't hesitate to contact us. Thank you again for being here today.
Thank you.
Thank you. Goodbye.
Thank you. Bye-bye.